Good evening. This is the North Andover Board of Health meeting, Thursday, April the 28th, 2022, 7 p.m. I'm Joe McCarthy, Board Chairman, and other board members in attendance are to my left, Michelle Davis, she's the board clerk. To her left, Dr. Max Tilson. To my right, Dr. Patrick Scanlon. He's also the town physician. Department members, to Max's right, Brian LaGrasse. He's the director. And Steve Casey, he's a public health inspector. And to our far left over here is the town nurse, Carolyn Lamb. So we have a quorum. Meeting is open. The first order of business is a pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Approval of our minutes?
No, we don't have any minutes to review.
Okay. Before we go through the agenda, I'd just like to make a quick announcement. Board member Daphne Alva LaFleur, she resigned due to personal reasons, and we wish her and her family nothing but the best, and she certainly will be missed by all of us. Public hearing. Dean Dinan, appeal of septic installer's license application denial. And that license application was denied by the North Andover Board of Health. Dean?
Yes.
You can come to the podium if you'd like, but first I'm going to turn it over to Brian and Steve. So tell us what this is all about.
Last season, Dean did some work in town. He did an install for a homeowner here in town. And there was some issues with the construction materials that we used. We typically inspect the sand that goes below the system, which helps the effluent drain and get bacteria grows and eats all the nutrients and makes clean water. So we did the inspection of sand when he first started the bottom bed and to build the system up. The sand passed, and then he went to a different company and got a different kind of sand. So he built the system with the other sand. We did a final inspection. I'll let Steve talk about that. When the system was constructed and noticed that the sand was different. We took the sand, took samples of it, had it analyzed by a company doing a sieve analysis, and it failed Title V. It did not meet the criteria that we need to have below the system. So, long story short, it took a long time to rectify. The system had to be rebuilt. Another installer came in to finish the job. There was a sale in the process going on, so that caused some issues with the old homeowners selling it to the new homeowners. There was a lot of issues with the transfer of property, and it caused a lot of headaches. So when he applied this year, I decided to deny his application based on the issues we had last season. I think that as an installer, he should know when sand does and does not meet Title V. It's actually in the Title V regulations that they have to be knowledgeable in construction practices and in Title V. And for some reason that was missed, and it caused a lot of headaches and a lot of problems last year.
Now, this letter that was sent to you on April the 6th, denying you of this application, the big one is the sand, but there are also 6 others, major issues, or certainly issues of concern. But I'd like you to focus on first the big one, the sand, and tell us from your perspective if these findings are legit or if they are incorrect.
Well, they did a soil sample of the sand, and after the sample was taken and the results were submitted, I called the lab, and I asked the lab how you take a soil sample. And they gave me instructions on how to take a sample. So I called Brian, and I told him what the lab tech had told me, and I told him that the sample was taken improperly, and that the verbiage was that it was not a proper good representative of the pile, was the quote from the lab tech. So Brian, they did, I requested for another sample, and that either the lab tech come out or myself, the engineer, and whoever else to do the second sample. Brian said he would get back to me, and then when I heard back, they had already done a second sample on their own without, they didn't notify me or the engineer. But anyway, there was a second sample taken. And that come back a little better, but still not compliant with the regulation. So I called, actually, I think Dan, the gentleman who took the sample, I said the sample was taken incorrectly again. I think he wrote a letter stating on how he took the sample, the practice that he used. And then I went out and I did a sample myself from how the lab tech told me to do a sample, and I submitted it to another laboratory, and I got a result as well, which I gave to Brian. And that sample had passed. And I have it here. I have the document here, and Brian has a copy as well.
We have a copy in the file. We took two separate samples on 2 different occasions. We talked to not the lab tech, we talked to the engineer that runs the company that does the samples, and we also talked to Dan Ottenheimer, who's our consulting engineer, and did it according to what they recommended. So we dug down about 2.5 feet into the system, took a representative sample in 2 different locations, and combined them together both times. So it was a total of 4 different locations and 2 samples.
So,
So it was representative according to their engineer and our engineer.
I offered to have a lab tech come out and do it himself, a third party, and I would pay to have him come out in the field and do it himself. But, I didn't get an answer.
At this point in time, we did 2 samples, 2 rounds, sent them off for analysis. They both failed. There was a transfer of the property in progress. People were getting very antsy and very upset. So we had to move forward with just making a decision and having it done at that point.
Actually, the transfer was made. It went into escrow, and the transfer was made. The owner moved in. The new owner moved in.
How often
And that was going to happen anyway.
do failures of the samples happen on average?
Very rarely.
I think this is the first time they've ever tested.
was all the sand
I think
purchased
that's
from?
what Steve told me. First
Okay.
time he's ever tested.
Was
Yeah.
all the sand purchased from Bentley Warren?
No, some sand was purchased from Bentley Warren. Some sand was purchased from another supplier, Lynch Materials.
Because the first sample that passed was purchased from Bentley Warren, and subsequent samples do not appear to have passed.
Steve, go on. I'm sorry to interrupt.
So the question I have, and by the way, years ago I was a Title V septic system inspector, so I know a little bit about this. Did you have prior confirmation that the sand purchased from the different supplier was septic system quality sand? That is, the sand would meet Title V regulations. And this is why I asked. I can go out and buy sand right now, and while this information may be a little bit dated, but a large quantity of sand, I believe you had more than 200 cubic yards of sand.
It's a large quantity of
Yeah,
sand.
yeah, so large quantity of sand can be as cheap as $10 a cubic yard. However, this fine sand that has been sifted and size, but different particles, can be up to $50+ a cubic yard. So if you're talking about several hundred cubic yards, the difference between quality sand is $10,000+ versus cheap sand, which would be $2,000. And I'm saying, I'm not accusing you of anything, but I'm saying to myself, this doesn't register. I'm missing something here, because it is an opportunity for any contractor to make an additional $8,000 to $10,000. So the question is, again, from this other provider, this different provider, and you could have stayed with Bentley Warren because the sand passed, but you went elsewhere. Did that provider tell you that this is septic system sand? And do you
Now-
have confirmation that the provider gave you that information?
They hold themselves out to the public, and they sell septic system sand. And to answer your point on the price, Brian was provided receipts and slips. And if you look at the slips, the sand from the other company was more money than the sand from Bentley Warren, price-wise. Reason for going to them was the trucking was taking so long. It was days of trucking, not hours, days, because of the amount of sand.
And this other provider was.
The sand was more money.
They did assure you before you bought it that it's septic.
You call them on the phone, they
Quality
say they have
They
septic, they
have.
have, yes.
Okay. Have you spoken with them about this at all? Because it says that they are giving you that assurance, but it's questionable whether it even passed.
It didn't pass.
Well,
So it's
like-
not questionable.
well,
He says otherwise.
I have a report that it says it passed. We, you know,
I know. We have two that says it didn't.
exactly.
That's what it
And, you know,
So-
I don't wanna, you know, I don't wanna overlook this, but
It
I
failed-
understand.
It failed the field test, which prompted the sieve analysis. We did two of them. And the
Again,
field test
I have
failed
one
and
as
two
well.
sieves failed. So you can't use it. You can't use that sand. It was screen sand. It wasn't C33. It wasn't stated on your receipts that it was Title V sand. It said screen sand. So
Companies call different product, I mean, you saw the
Okay.
price of, you saw the price of material.
other installers we've talked to said you don't get screen sand. You said that's junk.
Well, that's what they, you know, they hold themselves out to the public. You know,
So then they-
obviously,
Then you need to go after them and deal with this
well,
because.
I didn't think we were gonna be here for this, you know.
Yeah.
I understand it was gonna be brought up this one point, and I
Okay.
understand it, but,
But this was the major hurdle, and there were other things too that
well.
they weren't done when you requested a final inspection.
If the major hurdle, if this was gonna be the major hurdle, my opinion, I would have liked to, like I said, I was willing to pay for a third-party inspector from a lab technician to go out. I was happy to pay that. And why that was refused, I don't know why it was refused.
Because we did two samples and they both failed.
Okay,
That's
well.
why. I'm not gonna spin
Okay.
around the tree all day long.
Exactly, and I'm not here to do that. I'm
Okay.
not here to complain, you know, to talk
Okay.
about the sand.
So that sand was one of 7 issues. And again, this letter from our department was sent to you on the 6th of April. Do you disagree with any of the other issues brought to your attention?
I do. I mean, we can go right down the list.
Okay. Start with the first one.
The first one, I do not disagree that when we measured the hole was not to proper size,
Okay.
okay? And I apologize for that. And what I disagree with was it saying that it did require reinspection, but I apologized and I made sure that the inspection lined up with the bottom of tank hole so not to waste time, because I'm not here to waste people's time. So when he came in, he did 2 inspections at the same time, so not to make a separate trip. And I did apologize for that
Okay.
oversight.
It's valid.
Now, number 2, it said that the tank did not have the manhole cover to grade. That tank was put in 5 years ago on a conditional passing Title V inspection report, along with a D-box, and both of those had certificates of compliance signed off from the town of North Andover. And in the plan, it was said to use existing tank So, and that tank was compliant, and the plan was approved.
It probably had a note on it saying manhole coverage to grade.
It said existing tank, but anyway.
Okay.
So that had a COC, the tank had a COC. So I said, when he brought it up, I said, I'm happy to do it. I said, the tank was compliant from the town 5 years ago, but I'm happy to do it.
When a company comes in and either has to redo a septic tank or anything, does that company essentially then own full responsibility of that septic system now, since they're
No.
going in there and modifying, like they're responsible
Oh, yeah.
for
Once
everything?
he's coming in to do the whole system over, then yes, you do the whole leach field.
Okay, so what I'm getting at
New
is
pump
that,
chamber, floats, the whole thing.
so what I'm getting at is that
That
issue
component
5
was
years
not
ago
changed.
now falls under him because he's doing this issue of the inspection.
It depends on what's in the plan, but yes, everything's gonna be brought up to code.
Okay, got it.
But it
Which makes
was,
sense.
it was to code. It was to code 5 years ago, brand new.
But if
Put
there
in.
was no manhole cover this
Signed off
time,
from the town.
it should fall into you now, because now you're,
It depends on if it was on the plan, which I'm pretty sure it was. Dan makes everybody do that to
Okay.
grade now. That's standard practice.
Over,
But,
over an effluent filter,
yeah,
because you have to clean it every 6 months.
right,
got it,
That's why, it's because you have to access it more. The
Right.
homeowner should be able to do it.
okay.
yeah. And
So that was, the third one is, it said here something about the floats. And I have the code book here. There's nothing in the code book that says anything about how to fasten floats to a float tree.
okay, so electrical tape inside a septic pump chamber is gonna last.
I use that all the time, and I learned that trick in the field from other people who do that. And the reason, I explained, Dan, the reason why I do that is because when I go out to do pump assessments when they're damaged, more often than not, when I pull the pump out, there's something either in the impeller, like a zip tie or stuff that falls off from corrosion from the gases in the tank that will just not withstand that environment. And
Okay.
more often than not, I have never seen that happen with the compression tape. You can call it electrical tape, compression tape. When it's wound many times, it does not. And if it does fail, the pump can spit it. So you're not gonna damage a $400 pump because of a 10-cent zip tie.
Our engineer recommended zip ties.
It was in his opinion. It's not in the code.
Okay. So our engineer didn't pass it.
Okay.
Again, it's opinion. And
Okay.
on the denial letter, it states code. It says, I'm not knowledgeable about code.
Okay.
That's not code, that's opinion. And then we get to the D box, again, if you look in the code, it is a bylaw.
Correct.
And that bylaw, the bylaw is not mass code. It's
It's
your
not.
bylaw.
Right.
And the thing is, with this one specific thing, I don't know, this is an antiquated bylaw, it's more than 20 years old.
I don't think it's that old, but, okay.
And
It's
the,
2010.
the manufacturers,
2010.
the manufacturers have addressed this problem because people were complaining
Yeah.
that D-boxes were becoming compromised. So they've gasketed these things up where that's an unnecessary, and that's why it gets overlooked.
Okay.
And that, again, it's not code in the mass code book. It is
our
a
local
bylaw.
code.
It is a bylaw, but it's not,
Okay.
And again, I think this is probably more than, I believe it was in the late 90s when the manufacturers, Shea Products, they redesigned the tanks and the D-boxes with, gasketed plastic gaskets that do not corrode or
Okay.
rot over time.
Okay.
The whole box will disintegrate before a penetration will disintegrate.
All right.
So, and then the other thing was the sand, and that was the other point. So all of these points, I don't feel that it shows a lack of knowledge. I have been doing this for over 25 years in some capacity. In the last 12 years, I've been a certified Title V inspector, which requires continuing education courses.
Okay.
And I've been a licensed installer for over 15 years in over 10 communities
Yeah.
in the North Shore.
Have you lost your license in any other towns?
I have lost my license in one other town.
Okay. Why?
I do not know, because I wasn't allowed an appeal, a hearing.
Okay.
I was denied a hearing. I had
You denied a hearing?
I was denied a hearing. I had a lawyer come barge into a board meeting,
Yeah.
and with myself present and the lawyer, and the gentleman explained to the health agent, I'm not gonna say who, explained to the health agent, and the health agent still denied me the hearing.
Have you
All right.
had any installation issues elsewhere in North
Never.
Andover?
How about Andover?
An installation issue?
Yeah.
No.
No.
So, what do you think?
So what you're saying is that the sand samples taken, certainly that you took, passed the SIP test?
Yes, and again, I gave that to Paperworks and Brian. And
But
then I
that's
requested,
inconsistent with
Correct.
the samples that we,
and then I requested a lab tech come out.
So we wouldn't have done the sampling if it passed the field test, and as soon as we picked it up, it was obvious that there was a high level of fines in there. So you should have known that when you got the sand and started putting it in. You should have seen it and not put the sand
So-
in and not gone anywhere near that and sent it back, or addressed it with, not Bentley Moore, the other
Lynch.
company, Lynch, right away.
So what Brian is referring to, just so you guys know, with the field test is basically with sand, Title V sets regulations for how many fines can be in it, based on a sieve analysis, which is passed through different size sieves, and each sieve is smaller than the next to a certain degree, and only a percentage can pass through each one. So when you go out in the field, what you can do is a simple hand test, which basically you can grab like a thing of sand, and if you let go of it, obviously any sand you pick up, you'll get the small particles that stick to your hand. But if like the base color of your hand changes color, that's because there's a lot of like fines in it, like clays, silts, and things like that. That's what he's referring to when he's talking about the field test. So when Dan went out and when we did the final inspection with Dean, what Dan does at each final inspection is he digs down into the sand so he doesn't take it right off the surface. And he takes a handful, you rub it around a little bit, and you drop it, and his hand was like basically like a different color. And that's what triggered the sieve analysis.
so we took 3 samples, the first pass, and the second, and the third.
We did two.
Yeah,
We
two.
did two. We did two, and at each one we did it from at least 3 different spots on the field.
I misunderstood.
Yep. So it's like a composite
Okay.
from different areas of the system.
And the first passed?
The first didn't pass.
No.
I thought you said the first
When he said that was
passed from Bentley Warren.
The on-site
Oh,
inspection.
yeah. So I'm sorry. Yeah. So
It did,
we do
right.
one when he gets to the first load. When
Right.
you do the bottom of the bed.
But
yeah.
the subsequent samples taken did not pass.
So no, at the
Okay.
final construction, we took a sample, and then afterwards, we took another sample.
And yet what he provided you says that, hey, these samples all passed.
I have photos of me taking the samples. And like I said, I requested to have a lab tech come out and do it under my, I would pay.
What, did you feel that the town was trying to,
I didn't
Going
feel,
over-
I just felt that since they said it was the first time they had done this, that maybe they were doing something wrong. And the lab tech told me to do it a different way, and I said that was not the way that the town did their tests. So I said, would you be willing to come out on the site and do a test? And they said yes.
Do you routinely field test the sand that's going into these things before you put it in?
No.
You don't?
is that standard practice?
No.
Not to, or just,
For me to test? No. For
Okay.
an installer to test the sand, there's no.
They usually get a sieve analysis when they get the first load of sand. It gets
Okay.
one sent from the company. We require it, so to avoid this,
Is the presumption that the rest of it's gonna come from the same place? Is that why you do it?
correct.
Typically.
can I ask what remediation would be required
if a license is denied, what is the remediation process?
Remediation
How
process?
to get a
So-
license.
so how does he get his
How to
license back?
He could reapply next year.
Can he just reapply, or does he have to or,
He would have to reapply.
and then what would change? For instance, if, if you're disciplined by the medical board, there's certain things that you'd have to do to show that you've remediated, you've educated yourself, and done some things like that. Is there any remediation that?
Depending on if we do redo our regs this year, it could be required to take another test. We have a septic consultants test we issue out before we give somebody a license.
Okay,
You only do it once, and once you get your license, you can renew it. So if he gets denied this year, he'd have to probably retake the test to reapply.
is there any reason why he can't, since he was denied, retake the test within a certain period of time, and then it gets, he's then taken the test, if he passed the test and he's exhibited his knowledge, that he can then have the license renewed earlier?
I figured I would deny it for this season
Okay.
and go at it again next year.
That test, that's a state test.
No,
No, it's a
it's a
local.
local test. The system inspector is a state test.
Oh, okay.
This is
'Cause
just
I'm
our
saying to myself,
local-
hey,
local
I have a
installers.
state license, okay. Got it.
Yeah.
Got it.
So, my recommendation would be to suspend it for this year or not issue it this year. I think it definitely sends a clear message that we're not going to stand for shortcomings on installations out in the field. Like we do when somebody sells tobacco to a minor, we suspend their license. Same thing.
So there are three things that we could do. We could accept this denial,
Yep.
drop the denial,
Yep.
or, as Patrick said, maybe somewhere
Modify it.
between.
Can I say something?
Sure.
I don't have a problem with the 1-year suspension. If you presented it to me that way, I wouldn't have a problem with it.
Okay, you can reapply
I mean, I
next
was
year.
just, it just kind of took me a little bit aback. I understand it was believe me, I mean, it was a terrible, the whole thing was, the whole scenario at that job site was just,
It was.
But had you presented it to me that way, I wouldn't have even come to this meeting. I would have been happy to take a
Okay.
1-year suspension.
Great,
Then I would support that.
100%.
There you go.
I'll make a motion to uphold the 1-year suspension, and then you are to reapply next year. When do the license renew?
April.
Next April 2023?
Or, well, yeah, that's when the season starts.
This is
Yeah, yeah.
season opens.
Season opens
You know
in
when
April.
the.
But yeah, beginning of the year, I could apply.
Yeah,
Yep.
just
Okay.
reach out to us.
That's fine.
Okay,
Okay.
I'm happy with that.
Is there a
I'll
second?
second it.
Okay, all those in favor say aye.
Okay.
Is it just a reapply, or do
Yep.
you want
Yeah,
a
I think
test or no?
No,
Yeah.
just
We'll have to
reapply.
retest, but we'll
reapply.
reapply.
Okay.
Motion's
So, yes.
been made,
Understands.
seconded, approved.
Okay.
Yeah.
Thank you.
Thank you.
Thank you, I
Okay.
appreciate it.
Thanks, Dean.
Communications, announcements, and discussions. COVID-19.
Still
This
here.
has been, it's been on our agenda for years,
I know.
but it's important, and as I said,
Yes.
more often than not in past meetings, my highlight has always been the
Yep.
meetings, listening to what Brian has to say
Yeah.
and our doctors in the field, not the politicians and the talking heads and so forth. So
So-
Brian, tell us what's happening here.
We're seeing a little bit of an uptick. Did you wanna add in anything? Or
We're seeing a little bit of an uptick in like flu, but masks are off, people are inside, people are going out more. It's not a huge uptick. We're still have very strong vaccination rates. Joe has gotten his second booster. So,
And I will talk about that.
Yes.
Good job.
so it's not a huge uptick. We're not at zero, but we're not where we were in December. Nowhere close.
Which is really good. Yeah, so, I mean, the BA2 variant, they say it's more transmissive. We do see waning immunity in terms of looking at all of our cases. A lot of them have been vaccinated and have been boosted. But the symptoms aren't quite as severe from what we're being told. I would like your opinions on that as you guys are seeing it firsthand.
It's been 6 weeks to 2 months since I have taken care of an ICU patient with COVID.
They're on the medical floors, just because everyone who comes into the hospital gets tested.
Mhm.
So about 50% of the people who are on the medical floors, and I think that in the hospitals now, they're well under 20 cases. At one point, at the very lowest point, I think there were 4 or 3 cases in the hospital. It got almost up to 20 as recently as 3 weeks ago, and now it's back down to the low teens. And 50% of those are completely asymptomatic, in for a broken leg, and they happen to test them, and they turn out.
Oh, really?
Yeah.
Okay, so a lot of incidental,
Yeah.
okay.
And they're just on the floor, not sick.
Right.
Even the people who are with symptoms are not his level sick, they're my level sick.
Okay, that's actually good to hear. I think, obviously the vaccination rates are extremely good here. I do think that plays a huge role in it. And it's good to hear that people aren't going into the ICU. And we did have 1 additional death this past week. And we're up to 94 total in North Andover over the 2 years. So it's a little chunk there. And obviously in the packet, there's the graph that shows the ages. I think that's obviously elderly are definitely more susceptible. I did add in the wastewater data from GLSD. So I emailed over to Colleen Spiro, who works there. Sends the data out. I said, hey, put me on your list. And I've worked with her before in the past about different things. Yeah. So I added in 2 of the sheets that you guys have here and the graphs, so it's just seeing what their concentrations are. So you did see a little uptick between the 3rd and the 6th. I didn't go through and print them all out. I just printed out a couple. And then the last page is a bigger graph that shows you the huge spike and peak we had back around Christmas. So you can see at the end of that, it is kind of trending up a little bit, but not anything near like what we saw before.
So these are variants.
It's an Omicron variant,
Delta,
yes.
Omicron,
This is
BA2, BA2.12.2, I believe, which is the latest. Are we going in the direction wherein these variants of the virus are less deadly, each one with respect to the one before, or is it hard to say?
Well, I mean, I think that if you compare the death rate of infection now versus what it was 2 years ago, these people aren't dying as much as they were 2 years ago, but people are immune, people are getting vaccinated. I haven't looked at the comparison of an apples to apples comparison of what happens if an unimmunized person gets Omicron versus someone who got infected with the original virus 2 years ago. I haven't compared that. I don't know if you have or not.
No, I haven't.
But that would be the only way you could compare it, Joe, would be to say, did an unvaccinated person, their likelihood of dying with all the same, let's say you take the same person with the same comorbidities and infect them with both viruses, what's the likelihood that one's gonna die and one is not? I haven't seen that data. There's been a lot of stuff on television about the fact that this is more transmissible but less severe, but I haven't seen that borne out.
More transmissible but less severe.
Right.
Yeah, as a matter of fact, I read this past week that in the United States, about 60% of the populace have had the virus. And that's been confirmed by antibody test. An extraordinarily high number. I mean, I might have had it a couple years ago and didn't even know it, but 60%. So you have the natural immunity built in, plus the people who've had their shots. So certainly going in the right direction. Anything else, Brian?
Yes, I did add in a sheet towards the back of your packet, some highlighting on there. As a region with a bunch of other communities around us, we're gonna go for a shared services public health grant. It is $300,000 for 3 years to hire some regional staff to help augment some shortcomings and some gaps that we all have in terms of either backfill vacations or public health nursing assistants with some of the towns that don't have what we have, and some regionalization trainings. So we're gonna bring some people on board in the region to help out all the communities in the area, which is good. So we got 6 communities right now partnering up together to apply for this grant, which is due next week. And then I'm pretty sure we're gonna get it. I've already spoken to some of the communities that we're working with and partnered up with, that the state is trying to push these so people can help augment their lack of staff with regional staff. So I think that's a really good thing. It's in the process right now. It's due next Tuesday, and hopefully we'll hear back shortly thereafter.
What do you think you need that this will address here in North Andover?
One of the things that we're talking about is a training coordinator. So to get regional trainings for all of us to take and to help standardize our inspection process, or for instance, we do mobile food inspections. So if a mobile food truck comes into town, every single town has an application and an inspection. So it's a lot of work for us and the applicant having to go get inspected at every single town in the area, whereas we can standardize it and do one inspection, one application. Might be a way to be more efficient, lessen our burden and lessen the applicant's burden. But regional trainings is definitely something we're looking for. FDA has a standardization program for food protection inspections. Maybe getting some trainings done with that would be ideal. So all of the inspectors in this area are all doing and looking for the same stuff, versus pet peeve of this person over here versus this person over here. Trying to standardize that inspection process for restaurants and inspectors here, I think is definitely something really good. And then public health nursing, we have Carolyn who's full-time, which is fantastic. Some other towns in the area that are smaller don't have a full-time public health nurse, and they need it, they need help. So with communicable diseases, routine clinics, that kind of stuff, they can have some regional help to accomplish what they want to do. But
Is it split among the communities, or is there one lead town that gets it?
well,
Like
we're
the
going to be the lead.
districts? We are.
Yeah, we're going to lead it, but obviously the staff will be shared throughout the area. Yeah, so that's one thing. And then also the community health assessment has gone out to bid. So we had to do the RFP process for that, which with everything going on this winter took a lot longer than we had hoped. We hope to get it out in January. It just got out last month. The bids are due next week, so we should be receiving the applications now and proposals from different companies. I'm gonna rope in your friend Andrew.
Yeah.
Have him kind of partner up and take a look at some of these with me
Great.
and see where we can go from there. But I didn't forget about him.
I'm gonna see him this weekend. I'll
Oh, you are? Okay,
yeah.
good. It's just been a long process and it got pushed off due to everything else going on.
What
But
are
yeah,
the 6 towns that you guys are partnering with, just so I can just.
let's see, Andover, North Andover, Reading, North Reading, Linfield, Wilmington, and Haverhill.
So all regional, all
Yes.
local regional.
Yep, they're all part of our public health coalition, which we do planning with, and I've been working with them for 20-plus years at this point.
Yeah.
Haverhill is in a different region, but they weren't grouped in with anybody, so they had reached out, and I talked to someone from MAHB today and asked if we could allow Haverhill to join us. And I said, of course.
That's great.
So, yeah. So yeah, so the community health assessment and public health excellent grant are in the works. We're slowly getting past COVID.
Animal regulations?
I have some more work to do on that, but they're almost there. Methuen has a really robust regulation that I want to go through and pick from that I didn't get to do before you guys got the first draft. So once I get this grant filed next week, I should have some time to go through the other regulations and incorporate some new pieces into it. And what do you got?
That's about it. It's been crazy.
Yes, and hopefully Tony's back next week. She wants to come back more than we want her back. She definitely misses us.
Yesterday, I received a second,
And obviously we miss her too, by the way.
very much as a matter of fact, but I
Yeah,
received a
definitely.
second booster shot because I'm over 50, which means I could have received a second booster shot 50, 60 years ago, but nevertheless. And Callan gave it to me. She also updated my vaccination card, found out why I couldn't access my online vaccination record. I didn't exist in the system because my name was misspelled, okay? And she looked into it and she made the change. I could not do that because, you know, I don't have access, but she does.
So is it Joe or McCarthy spelled wrong?
Actually, his name is Bob.
And by the way, if this vaccination record, it's maxvaxrecords.mass.gov. I'll go over it again. myvaxrecords.mass.gov. And I bring this experience up because it concerns the people and it concerns other people, people that are watching and other people here in the board and the department right now. Our town does a lot for the people, and if you have, say, an issue with shots, speak with Kellen. She'll put you in the right direction. She'll set up a meeting for you, so she can talk with you about it. You know, she'll give you the vaccine shot. She'll check your records to see if they're accurate. So, good job. I'm really, really impressed with how it went. Of course, mind you, if I could have done this 50, 60 years ago, I'd be very old, so I'm kind of losing it right now, but good job.
Awesome.
Much appreciated.
I believe Moderna today announced that they're going
Yeah.
to the FDA for 6 months to
Yeah.
5 years.
Oh,
Oh,
okay.
okay, I was good. I heard it was under 6 years old,
No, 6
but I'm
months.
saying to myself, I didn't know, it goes all the way down to 6 months.
Yeah.
And they are the first. Pfizer hasn't,
Their data wasn't as robust.
Pfizer was supposed to in April, but they weren't getting.
so this is
it.
just the emergency authorization.
Yes.
Yes, that's
Wow,
first.
down to 6 months. Ooh.
I mean, you look at the amount of vaccines that our kids get now,
Yeah.
right when
that's
they're born.
true. Yeah.
And I'm all for it.
Yeah, I agree, 100%.
Anything else?
You good?
Then we need a motion.
Motion.
To adjourn.
Motion to adjourn, sorry.
That'd be something different to a
I was
gastroenterologist.
actually more just.
Can I help you with a second? Because I can't make the
I
second.
was like, I'm not making a second till I know what we're voting.
Yeah, I'll second that.
Okay, all those in favor say aye.
Aye.
Meeting adjourned.